Today's discussion has generated a number of questions already, and the first one I would like to direct to you, Dr. Azeltine. The question is, can you go into more detail on your effect of SOS on help seeking? Were you surprised that SOS did not have an impact on help seeking when compared to the control group?
Yes, I was surprised by that, particularly when we have evidence from other sources, and Sarah's presentation, I think, highlighted what some of those sources are, that indicate that schools actually see more students presenting for emotional issues following exposure to the program. So we know that in most schools that is happening at the school level. Now, there are other resources that students are encouraged to use. If they don't feel that they can talk to a trusted adult at school, there are adults outside of school that can be accessed. So there are a variety of different ways that they can get help, and that's why self-reports, as is obtained in our studies, are a different and important component as well. One of the issues that we've had to face is that when SOS is implemented as a universal program, we as researchers lose a little bit of control over what happens to those that aren't exposed to the program. And so there's the potential here for a little contamination where once it's out there and once kids know what to do when confronted with a friend who is in turmoil, they'll act whether or not that student has been exposed to the program or not. So I think that has affected our results, the ones that I reported here. We have since done some work where schools are assigned to treatment and control groups at the school level, so that everybody in the school is getting SOS versus those in other schools that are not getting it until later in the school year. And even there, we're not seeing much in the way of help-seeking results. And again, the problem that we have is that most of those schools had already participated in the program, and so the potential for new ninth grade students, even though they hadn't been exposed to it, to be in an environment which was encouraging students to get help, regardless of whether they had had the program, we think that could be problematic. So we're still working from a methodological perspective on ways to assess this. But I think the independent data that you get from counseling offices and from school reports does indicate that there is a help-seeking effect.
Thank you, Dr. Azeltine. Now we have a question for Dr. Coe. How are the offices working across the Department of Health and Human Services to achieve these Healthy People 2020 leading health indicators?
Well, in general, we have a federal interagency work group that coordinates these activities across government. We have leadership within Health and Human Services from our Office of Disease Prevention and Health Promotion. And then on the particular area of mental health, as I mentioned, we have a behavioral health coordinating committee that includes all the operating divisions, all the agencies, and is co-chaired by Pam Hyde and myself. So we have extraordinary coordination on this issue, and we're very, very proud of that.
Thank you, Dr. Coe. Now we have a question for Ms. Strawn. What do you think made implementation in your school district so successful?
I would say our community receptiveness. I mentioned briefly the funding that we received from the county, and I truly think that having that county stamp of approval on the programs that we were doing made the schools in the area very receptive. Also, it's contagious. Once one district buys in and does it, you use that district, and that results in their backing to convince or persuade other districts to buy into the program as well.
Thank you, Ms. Strawn. Well, unfortunately, we've run out of time to answer all the questions that have been submitted, but we've recorded your questions and we'll address them through our Healthy People 2020 group on LinkedIn. Let me thank everyone for joining today's webinar. This webinar is part of a series, and we hope you'll continue to join us. Next month, our webinar will feature nutrition, physical activity, and obesity. Healthy People continues to look for real stories from organizations that are working to make its goals a reality. If your organization is doing great work on specific leading health indicators, we want to hear from you. Go to healthypeople.gov to submit your story. Again, follow us on Twitter or join the Healthy People 2020 group on LinkedIn to continue the conversation on this LHI topic, mental health, and to learn more about other leading health indicators. To receive notices about upcoming events, please sign up for our email announcements on the Healthy People website. That is www.healthypeople.gov. On behalf of HHS, I'd like to say thank you to today's presenters and to everyone who's been involved with planning and implementation of Healthy People 2020. In addition, let me encourage the participants on today's call to fill out the feedback survey that will be addressed at the end of the webinar. It enables us to improve the quality of future webinars. Thank you very much.